Hello! Today is August 15th, day 14 of my trip, and last day of treatment, which was exciting but bittersweet actually. It's so funny. It seems like I told the receptionist lady, Terry, that I felt like when I was saying goodbye to her, that I felt like I was just walking in and saying hello to her, and here we were saying goodbye already. Well, certainly there were points during the 2 weeks where it felt like it was dragging a little bit. It wasn't terrible, but there were points where I was like, oh, I want to go home. I want to sleep in my own bed. I want to see, my family and stuff like that. So, um, anyway, here we are, last day. I just got done over there. I did the checkout process, and all in all, it was a good day. So today I started with the ST8 and the Valkian, which again, ST8 is loosening lymph fluids. The Valkian is the oxygen mask. It's not really a mask, but it's the oxygen that supercharges your healing. Then I saw the doctor right away. I had gone over at 9 o'clock, so I saw the doctor just after 9:30. And that was a good appointment. It was great. I've really enjoyed my time with my doctor. His name is Dr. Jonathan Straight, and he's just been great doctor, caring person, really funny to me, just like a goofy kind of funny, which I enjoy. So, anyway, so we had our last. All day today I was saying, this is my last, and then fill in the blank. So I had my last appointment with my doctor just after 9:30, and we checked in, just discussing how different things were. He asked, my presenting symptoms, went through and asked, I had to give better, worse, the same sort of thing. So we went through that. Also reported my sleep last night, which might have been over 7 hours. I think it was at least 7 hours. Not 7 hours straight, but 7, maybe a little more than 7 hours. So that was exciting because sleep is amazing, and I have missed it. So I was very happy to report that, and he was psyched to hear it, so that was cool. Then he had me lay on the table face up, and he just kind of checked everything out, did the bioresonance scanning over all the things we've been working on and looking to see if there's anything else that we missed. Then he percussed my head a little bit more. The percussor, again, it feels like it's vibrating. He actually explained to me today it's not really vibrating, it's percussing. So I don't know if it's a percussory wave or what it is, but it's different than a vibration. But in any case, it feels like a vibration. He did that on the right side of my head. I've had a lot of pain right here that just won't go away. It gets better and worse at different times, but it just wouldn't go away altogether. And it seemed like perhaps percussing that needed to be percussed. And actually right now I feel pretty good right there. So it might have done the trick. I also had a massage today, and she worked that area and all around my head. Last night I put ice on the back of my head, and that helped up there too. So I think all of these things, the percussor on my head and the massage today, helped. So yeah, it actually feels pretty good right now. Still feels like it could use some rest, maybe? I don't know. But it doesn't hurt right now, so that's awesome, because that's been the one thing that has really mostly not gone away, except when I lay right on my face on the massage table. And as he was checking things, he found a spot of fascia on my right leg that needed some work yet. Just a small spot, so that was, he actually didn't even use the percussor because it was a real small spot. He just kind of I think he used his thumb, just stuck his thumb on it to sort of release it. More like a pressure point type thing. And then I asked if massage, like a regular massage, helps with the fascia, and he said yes, but that he recommends a visceral massage, and I did not ever hear of a visceral massage before. And it's where they massage inside your abdomen. Basically, they're sort of massaging all around your organs. That helps a lot of things, but one of the main things is to get to work with the fascia in the organs, and he said emotional stuff likes to hide in there, toxins and stuff like to hide in there between the organs and stuff. So a visceral massage, he said, would probably be really good for me for those reasons, toxins and the fascia stuff. So that's good. I just remembered something I forgot to put on my notes. So I'm writing it down so I don't forget. Then he, one thing we didn't work on at all, like directly, was discussing, let's see, it was 6 years ago, close to 7, that I was diagnosed with polycystic ovarian syndrome, which was actually the very first diagnosis I got. So I guess it's ironic that it's the very last thing that we actually directly dealt with today and on this trip. So he just checked out the cysts, and there's more in my right side than on my left side, and then he was doing the bioresonance scanning to find what would help it, and actually the remedy that ended up being the one is not directly for cysts, it's for something else, which means something else entirely is causing these cysts that seems to have nothing to do with anything. He read me some of the stuff in the books too that, you know, were nothing that seemed applicable to me that I know of. And so it's, but that's the thing with energy medicine really, is that it's not so much a remedy like the known, this kind of energy medicine. I'm not talking about new age energy medicine. I'm talking about this scientific based energy medicine that they do here is like whatever might be known about a remedy or a symptom or something isn't necessarily, again, it's not necessarily the direct cause, and it's not necessarily directly applicable to you, but the frequency of that remedy with that symptom or that problem is what's going to correct the actual underlying problem, and then the symptom will go away. And so it's kind of fascinating that, and I shouldn't say, like, actually it was the emotional things that he was reading out of the books about the remedy seemed to have nothing to do with me, again, like that I know of. There were some maybe minorly once in a while applied, but and that actually, that one was when we were talking about the pain in my head. I can't remember, it's been a long day now, and I can't remember how everything went with, it's easier to remember everything that happens in my doctor appointment when it's later in the day. So I don't remember now if whatever with my head, we also was going to be linked to the stuff with the ovarian stuff, or the cyst remedy. I don't remember. Anyway, that also might be one, because there were a couple of remedies that he just gave me one, and that should correct the problem. So that might have been one of those, the one for my eyes. And so that might be the one he was reading, that, because it had to do with being indecisive, and then it went on and on describing different kinds of indecisiveness and lack of self-confidence. Mostly didn't apply to me. Some of it did, but I'm actually, it doesn't matter. So anyway, we did the cyst thing. Got a remedy that was surprising and will correct whatever is wrong, but didn't actually seem to have anything to do with ovaries or cysts or anything like that. But I was glad that we dealt with it. That was actually not even something I even thought of asking about, but it was in my paperwork, and so he wanted to address it. Then we did emotional stuff. I've actually been, you know, a lot of people, they have emotional stuff just come up, and I mostly haven't had that, just a few times. And so he directly was checking for emotional issues that are affecting my physical body, and actually only found 2, at least 2 that were priority, that were like need to be dealt with right now. One was the first one was need for approval. Oh, and it was funny because when he described to me what he was going to do and what he's looking for, he talked about finding subconscious emotional issues, and the need for approval was my number 1, and that's absolutely not subconscious. I'm completely aware that that's an issue, and I certainly not surprised that that's my main emotional issue. So, and then the second one was thwarted. That was just the word. It was thwarted. Um, and so the way we dealt with that actually was not an internal remedy. It's something called, I don't know if it's actually called tapping. I saw some different things around the office that it just said tapping, but it's a technique that well, it's actually really fascinating. He explained to me how the mind, he drew me a picture of a head and kind of colored over it. And so that's the mind full of negative stuff that we are imprinted with, all this negative stuff, these lies that we believe from the enemy. And he talked in terms of the Christian viewpoint of lies from the enemy imprinting us and affecting us and causing us trouble in more ways than one. And then he basically explained how it takes, energetically speaking, one negative thought, sentence, word, whatever, one negative is equal to 10 positives. So you have to tell yourself, he was explaining to me that when I am thinking or feeling something negative, to state 10 positives, because energetically, it takes 10 positives to counteract one negative. And that's why all the negative stuff can really overcome us, is because for whatever reason, it can be more, I guess energetically it's more powerful, the words themselves. I guess now that I'm, regurgitating his words and thinking about it, I would hope that would mean, while you're under the influence of that lie, it's more powerful, but that when you gain victory over it, you shouldn't have to continue, biblically speaking, and what I know about healing is when you gain victory over something, you shouldn't continually have to spend that much time and intentional effort on counteracting the lies. When they come up, you can just say, "Oh, you're a liar, get out of here." And I have actually experienced that in my life. And so I would guess that's when you've been re-imprinted. So, I mean, that's all my thoughts on it. That wasn't anything he said. But anyway, so he explained, you need to basically clear your mind of the negative, not like the Eastern meditating way of like having an empty mind, but you need to clear the space and re-imprint your brain with the positives. And so he actually did there's a physical method of actually sort of clearing your mind, where he would just like I had to watch his fingers, and he did he did a bunch of movements, and I had to watch them. It actually took a while. And then I would tap here, just like this, tap, and then he would say things that I would repeat, and they would counteract the negative. So like for the need of approval, it was, something like I'm approved or I'm accepted or something. I forget what it was, but obviously it would be, the opposite of the negative. And the tapping is just, he explained, it's just a focus on what you're saying. You're not really doing anything other than you're making yourself focus on what you're saying. So it's not like some voodoo weirdo stuff. You're just trying to have techniques to help you focus on the truth and on the positive, so that you can overcome that lie that has imprinted in your body and in your brain, which is affecting you on many levels. And so it's not something that's instantaneous. You keep doing it, and again, this is biblical. You keep doing it until you overcome and you have the victory. So that was cool. And the second one was thwarting, and so that one, when I would tap and repeat after him, it had something to do with fulfilling my purpose or something. So that was cool too. So then I only had the 2 emotional things come up, which he said was good. And I was happy because I've done a lot of emotional work in the last decade or so, and so I was happy that we didn't have to spend like 45 minutes on all these buried emotions that are causing problems in my body. So then the last thing we did was, oh boy, this video is way over 10 minutes already. Sorry, I'm just gonna keep going until I'm done. It's the last one, so that'll just be the way it is. Then we did food allergies, and I had come with a list of food allergies that I had gotten from a blood test, and these were not these are more what they would refer to as a food sensitivity, because none of them were like that I have an anaphylactic, I think that's the word, reaction that would kill me or something. It's all just that it flares up my immune system. And I didn't have very long lists, so it wasn't too big of a deal. But, you certainly don't want to have food allergies and food sensitivities. And a couple of mine were sort of difficult to avoid, like eggs and bananas, pumpkin, cranberries, grapes, raisins too. Those were the kind of the top ones that were difficult for me to remember or to avoid or to remember to avoid. Like eggs and bananas are easy to remember, but some of the other ones like cranberries and raisins and stuff would be hard to remember, to look for them and avoid them. So I didn't have too many on this list. Some of them were funny, like beer. Beer was on my list. I don't even know last time I ever had beer. I don't like beer, so it's funny that came up. Saccharin, which he said you shouldn't be eating anyway. Beet greens. Again, I don't eat beet greens. Cream cheese. That's tough because I like cheesecake. It's sort of tough. It's not really because, well, I'll get to what he did to counteract them. But anyway, blackberries. I like blackberries. Swiss cheese I don't like, so that's fine. Not that I don't want to be allergic to it, but if I had to stay away from it, which I don't have to really worry about it, Swiss cheese wouldn't matter. Filberts, which I couldn't even think of what they were when I knew it was a nut, but I couldn't picture them when he said it. Pepper, again, I rarely eat pepper. Celery, tangerine, oregano, beef, honey, pecan, nectarine, eggplant. So most of those were actually quite different from the ones that were on my blood test from this spring. But here, it's so different than anywhere else. They test for them, and then he gives you the remedy one time to counteract that allergy, and then, or sensitivity, and then he says 99.9% of the time it's taken care of right away, but just in case he suggests you stay away from them for 24 hours. But that's it, then you should be fine. And unfortunately, he won't be able to recheck for me because I won't be back tomorrow to see him. But the way I've been healing, I'm not concerned about it at all. Everything has been awesome for me, and all my discs and everything have stayed in place. So yeah, and my pelvic muscles and things are releasing where they've been really tense and painful and just struggling for years and years now because of the disc problems, which I didn't know were disc problems till last week. Yeah, so, oh, and if you're somebody who has serious food allergies or knows someone with serious food allergies where you would actually have an anaphylactic shock or whatever it's called, they can take care of that here, so you don't have to live with that. Come and check out the Hansa Center and get well. So, yeah, that was it. Then he just, he said he was really, he's like, I can't even tell you how excited I am about how you've been doing and how you've been healing. Whatever you're doing, keep doing it, because it has primed your body. Again, these aren't his exact words. There are as many of them as I can remember, but some of them can't remember the exact words he used. I always hate to quote somebody or say somebody said whatever when I can't remember exactly what they said. But anyway, he was just saying he was really excited for my improvements and how I was doing, and that it was really, really great, and that whatever I've been doing has basically primed my body so that it can, when the things that are still problems, he could basically just tell the body what it needs to do, and my body would just be like, oh, okay, and flip on to doing it the right way. So it's really nice because I've put in so many years of emotional work and physical work to try to get well, and it has seemed like nothing really significant has happened. But it's not all lost, because it definitely seems to have put me in a position to, now that I knew where to go, my body could just receive the healing. So that's really exciting. Really, really exciting. Yeah, I feel like my tone and my words are not sufficient to to really express how exciting that is and how good that is, and how good it feels that all this effort and all this time is not wasted. So yeah, so then I was done with him, and I mean, not done with him, but I was done with my appointment. Then I went and had the Lux, which is the light therapy. I had it again on my forehead, heart, and navel, which is was called Optimum Coherence. And I had some water sounds in the sound therapy part of that. Did the power plate, which is the vibrating thing that I put my feet on and my calves and legs. Today I actually did my whole legs, not just my calves. And then I had a massage, which was good. I actually there's 3 massage therapists here, and I had only met 2 until today. Here's my last day, and I still had a new experience of a new massage therapist. Her name's Kathy, and she did a great job too. And then I had a sauna, had some lunch. Then I went back over, and all I had left was my foot bath. And there were 4 of us ladies in there that I've gotten to know a little bit over the time I've been here. And there was hardly anybody at the office all day today. A lot of people who were here for this week left yesterday, and so I guess it was abnormally down in numbers today. So it just felt like it was really a dead place, because it's alive, but I mean it was so quiet. Because there was hardly anyone there, and I would hardly see any of the other patients because we were all in our different therapies all at the same time. Nobody was like walking around or waiting between therapies. So anyway, all 4 of us, the 4 ladies that were left there yet today ended up, I think we were the only 4, we ended up in the foot bath room together this afternoon, and oh my goodness, that was the best foot bath time I ever had. We just laughed and laughed, talking goofy, and it was really fun. I really appreciated that to have experienced that, and that was my last therapy on my last day. So it was really fun to sort of go out with a bang and with joy and laughter. So yeah, that was good. And then I checked out and said goodbye to everybody. And here I am telling you about it. So I'll be headed home tomorrow, and I might do some video updates if I think of it and get time, just if anybody wants to continue knowing how things are going. So I'll post them on Facebook if I ever do that, so you can watch for that. All right, thanks for sticking with me.